AMI, acute myocardial infarction. This is our topic for tonight. Let me read, guys. Type 1 ST elevation myocardial infarction, STEMI, and non-ST elevation myocardial infarction and STEMI. The ICD-10-CM codes for type 1 acute myocardial infarction, AMI, identify the site such as anterolateral wall or true posterior wall. Subcategories I-21.0 to I-21.2 and code I-21.3 are used for type 1 ST elevation. Code I-21.4, non-ST elevation, myocardial infarction is used for the type of non-ST elevation, myocardial infarction, and non-transmural MIs. I know, guys, there are too big of words that I have just spouted. We just read, guys, the ST elevation and non-ST elevation. Those are really big words for MI, but let me try to simplify what those mean. Let me switch to the presentation for tonight, which is this one right here. The one that I just read, guys, is in this presentation. But let me first define, okay, what a myocardial infarction is. Let's go to this definition. According to Harvard Health Publishing, this is how they describe myocardial infarction. A heart attack occurs when one of the heart's coronary arteries is blocked suddenly or has extremely slow blood flow. A heart attack also is called myocardial infarction. The usual cause of sudden blockage in the coronary artery is the formation of blood clot, thrombus. The blood clot typically forms inside a coronary artery that already has been narrowed by atherosclerosis, a condition in which fatty deposits, plaques, build up along the inside walls of the blood vessels. And last paragraph here. Slow blood flow in a coronary artery can happen when the heart is beating very fast or the person has a low blood pressure. If the demand for the oxygen is greater than the supply of a heart attack, a heart attack can happen without formation of a blood clot. People with atherosclerosis are also more likely to have this reason for a heart attack. Okay, so let us break this down, guys. Let's unpack this. So what we just heard, guys, what we just read is a definition or a description of what a heart attack is in a layman's explanation. And I will do my best to be able to describe that, guys, in a more simple manner. Okay, when you talk about heart attack, what's happening to the heart, guys, from what we just read is that the heart is not getting sufficient supply of oxygen. And when that happens, that particular heart muscle will eventually die if it's not receiving that amount of oxygen that it requires. Now, there are several reasons why a heart muscle will not get enough oxygen that it needs. Okay, one that's mentioned in the one that we just read is that if one of those major arteries is a blood vessel, is occluded or blocked by a thrombus. Thrombus is a solid formation of a blood clot that is lodged into the artery that prevents the blood flow to the heart muscle. That's what thrombus is. Okay. Now, another reason for or a precursor to that incident of having a blood clot or thrombus is if the blood vessel continues to narrow, which we call atherosclerosis, okay, because of the continuous fatty deposit that is deposited to the inside of the arterial wall, then eventually, guys, the artery will be too narrow for the blood to flow freely to the heart muscle. So when that happens, guys, if the heart muscle is completely out of oxygen, what happens now? That heart muscle is going to die. And if that heart muscle dies, the heart stops functioning, stops working. And what happens if the heart stops working? The host or the person, the patient, will eventually die, because it is the heart, is the central organ that is responsible for pumping the blood into the whole body or the whole system. And that's what we call heart attack, guys. Okay, it's a dreaded disease, it's a dread condition, but heart attack is preventable because there are many ways how to uh, limit or to kind of like manage the the narrowing of the arteries. Okay, there are many ways. If Karen said it's silent killer of women. Yeah, not just women, but pretty much anyone, regardless of the gender. Anyone can suffer with a heart attack if not monitored. If not, if that patient, especially, is not mindful of of managing his or her health. There are people who like that, guys. The people who are afraid of or scared of going to the doctor, right? There are people like that. So I mean, if someone is not proactive in managing his or her health, then these conditions may happen to that person. Okay, so that's the plain definition of heart attack. Now let's continue with our reading here, guys. Let's look here. The myocardial infarction timeline. Let's read here. For encounters occurring while the myocardial infarction is equal to or less than 4 weeks old, including transfer to another acute setting or a post-acute setting, and the myocardial infarction meets the definition for other diagnosis, okay, codes from category I-21 may continue to be reported for encounters after the 4-week time frame, and the patient is still receiving care related to the myocardial infarction. The appropriate aftercare code should be assigned rather than a code from category I-21. And for old or healed myocardial infarctions not requiring further care, code I-25.2, old myocardial infarction, may be assigned. So I have here, guys, these codes that are mentioned in this narrative here. But before we even simplify what we are just read here, let me explain to you what that kind of myocardial infarction that was mentioned in in the guidelines. Remember the word STEMI and non-STEMI, right? Let me explain first what that STEMI and non-STEMI is. So what we just read, guys, right now is the timeline of myocardial infarction, but it's important for you to understand first, what does the guideline mean if they say STEMI or non-STEMI? Okay, let me write it down here. What's the difference? See my versus STEMI versus non-STEMI. When you hear the word STEMI, it actually talks about a specific cardiac test, guys, that that is manifested, okay, or that can manifest the heart wave. And you guys are familiar with EKG, right? So EKG is a specific heart test which shows how those heart waves are behaving. So it actually looks at the rhythm or the pattern of the rhythm of the heart. That's what the EKG actually detects. The EKG, if you go look at the EKG result, guys, it appears like something like this. Well, it's not perfect, but have you guys seen a heart wave like this, right? It's not perfect, but what I'm trying to say is that the STEMI or non-STEMI is detected or can be determined through reading the EKG result. Okay, and that's the reason why I have it here in uh, in 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 our introduction here. This one right here. Okay, the image of the heart wave. Now, when they say when the doctor determines that this is a STEMI, the doctor actually talks about a specific segment of the heart wave. Okay, this one right here. This heart wave has actually labels. I think this one is P. This is Q. Let me just make sure that I'm giving you guys the right information. But what I'm trying to say, I think this is R, Q, R, S, T, something like that. Okay. So it's a specific heart wave that gives you, that specific pattern when the patient is getting a heart attack or having a heart attack. This wave here, this certain wave here is very elevated. That's why it calls ST elevation. Okay, let me if patient is having a heart attack that has ST elevation, this one is significantly increased. Like your wave, the patient's wave will look like that. Maybe it's exaggerated, but that's how ST elevation type of heart attack looks like. Okay? So this type of heart attack, guys, this is the acute type of heart attack, ST elevation. When this wave here is really, really up high, or it does increase significantly, that means to say patient is having a serious myocardial infarction. Okay? Now, of course, the opposite of that is the non-ST elevation, which patient is having a heart attack, but this wave here looks normal. It's not showing any elevation of that segment of the heart wave. That's the non-STEMI. So again, guys, the STEMI and the non-STEMI can be determined or can be seen through the EKG, and you can only see this result through that test that is called EKG. Okay? Any question, guys, from what I have given you guys this illustration? So far, okay? Oh, so far so good. Now having this idea, understanding now what a ST or non-ST or NSTEMI type of heart attack, guys. Now let's go to the timeline that we just read earlier. Oh, let me erase this one, and I will give you guys that illustration, and I will explain that to you what those timeline mean. According to what we just read, okay, the timeline for the threshold for the myocardial infarction has, let me see here. It says here, for encounters after 4 weeks. So this is your timeline here, 4-week time frame, which means that as coders, guys, okay, we're going to watch that time frame in assigning the codes for myocardial infarction. When you talk about myocardial infarction or heart attack, how do you guys look for the code? Okay, this is how you look for the code. I think we have done this exercise from last meeting, heart attack. This is how you look for the code. You go to the book and go to myocardium. okay? And then look for that, oh, no. Go to infarction and then myocardium and then look for ST elevation. Let's go try that, guys. Let's look for the code for STEMI right here. And tell me what code do you guys get when you go to infarction, myocardium, then look for ST elevation. Tell me what code do you guys get. Karen says it is I-21-3, and I totally agree, okay? I-21-3. Okay. Now, when a patient suffers an ST or ST elevation heart attack or STEMI, this is the code you are going to assign. Now, where is this 4-week time frame comes in? All right. Let's, for example, patient had a heart attack. Let me put a timeline here. Say patient had an attack on May 1st. Okay. So May 1st was the first incident of heart attack. Patient was treated, and after on May 7th, okay, patient was discharged. Okay, May 7th, patient was discharged. Now, on May 8th, on May 21st, which let's say we're talking about last year, May 21st, patient again suffered another heart attack. This time it is it's unspecified heart attack, just acute MI. Okay, so May 1st is the initial STEMI, this one right here. Code is I-21.3. On May 7th, patient was discharged, of course, no code. On May 21st, patient suffered another acute MI. I don't know what happened, but it can happen, right? So how are you going to treat this one? This acute MI here, because it occurred within the 4-week time frame, you're going to code this as a subsequent MI. Does that make sense, guys? Subsequent in the sense that you already have the first here. When a heart attack, a second heart attack happens within the 4-week time frame, okay, second MI, happening within a 4-week time frame, the second MI now, this is second, right? Acute MI is going to be coded as subsequent. Now, this time, guys, I'd like you to go again to your book, look for infarction, look for myocardium, and look for subsequent. And tell me, guys, what code do you get this time? It becomes, that is right. So you guys are telling me it is I-22.9 because this is an unspecified acute MI and it happened within the 4-week time frame. So now let's recap this. The first one, which is initial MI right here. This one is initial. Okay. This one here becomes subsequent. And remember, guys, you only code it subsequent if it happened again within the 4-week time frame. Does that make sense? Now, how are you going to code this? Because you have two MIs now. Patient was readmitted in the hospital because of a second acute MI. How are you going to code this now? You have two diagnoses here, the initial and also the subsequent. Okay, let me give you guys, let's put this in narrative. I'll put this in narrative so you guys have an idea what, what sequencing rule or what sequencing decision that you guys are going to make. All right. Say patient had, this is your scenario. Patient was admitted for STEMI on May 1st. Patient was treated and got discharged on May 7th. Okay. On May 21st, patient was readmitted for unspecified MI. This is the narrative here. Can everybody read it? I think you guys do, right? So, patient was admitted for STEMI on May 1st. Patient was treated and got discharged on May 7th. And on May 21st, patient was readmitted for unspecified MI. We have already determined your two codes here, your initial MI and also your subsequent MI. What does the guideline say about that? Let's read and go back to the guideline and read it again. For encounters occurring while the myocardial infarction is equal to or less than 4 weeks old, including transfers to another acute setting or a post-acute setting, and the myocardial infarction meets the definition for other diagnoses, okay, I-21 may continue to be reported. We have the I-21 for encounters after 4-week time frame, and the patient is still receiving care related to the myocardial infarction. The appropriate aftercare code should be assigned rather than a code from category I-21. For old, healed myocardial infarctions not requiring further care, code I-25.2, old myocardial infarction may be assigned. This means, guys, let's go back to our scenario here. We have already the I-21.3 because the guideline said if it occurred within the 4-week time frame and the patient still receiving care for these initial MI, you continue to assign this code I-21.3. Now, the I-22.9 is your new MI. Of course, you need to code that as well. Okay. Now, how are we going to sequence this? Let me ask you guys. This time, on May 21st, what was the reason for patients' readmission to the hospital? Is it the STEMI or is it the acute MI, the unspecified MI? It is the subsequent, right? It is the acute MI. So having said that, do you guys remember what the guidelines say? Whatever the reason for admission, that should be your principal diagnosis. Do you guys remember that guideline, that rule? Now, because of that rule, which one now should come first? It should be the I-22.9. I totally agree. This time, this is your primary diagnosis, okay? The I-22.9, and this is your other diagnosis, which is what the guideline is saying, you still continue to report that as pretty much, I-20.3, because that is still being taken care of. Am I making sense here, guys? Do you guys get what we're talking about here? Everybody gets that? Okay, perfect.